Thank you, President Cohen, and Happy New Year, everyone. And Michelle and Siva and John, welcome to the board, and thank you for being here. So as it loads up, as we do at every meeting now, we'll have our COVID update. There's quite a bit of information and some new things that I'll share as we go through. Next slide, please. So one of the good things that happened just yesterday is that the Oakland County Health Division opened the COVID-19 vaccine registrator for educators in the county. And it's just not educators that are in this group. It's going to be those that are 65 and older and other people as well. A couple things to keep in mind. While this is great news and we're excited, 75% of all the vaccines for this group are mandated by the state of Michigan to go to those 65 and older. That leaves 25% of the remaining vaccines to go to everyone else in the group. So please keep that in mind. I know based on talking to Oakland County Health Division today, it's going to take them a little bit of time to ramp up. By about midnight last night, they were able to register the max amount of people they could within this group. They also shared that they're not going to be able to prioritize a group. So it's not going to be one district over another. The only group that's kind of being prioritized because it's a state mandate, again, is going to be those that are 65 and older. So we did email instructions to our staff yesterday evening. I talked to quite a few staff members today that were able to sign up. There were a couple of glitches along the way where people got phone calls back saying, well, you're signed up for this day and this is the second day, but it needs to be X amount of days between the dose, so we'll need to find you a new day for that. And so the first dose appointments are available in the coming weeks, and it actually looks like we have staff members that are going for the first shot on Monday. So as Moderna vaccine comes online, as more Pfizer vaccines come in, it is really, really hopeful news and great news that we have this opportunity. Next slide. So looking at the last reporting period, which is December 23rd to January 5th, a couple things to notice. We do see some of the age groups going up, but it is a slight uptick overall. For example, there are 222 cases total, or 222 total, 220 case increase compared to the last update that we had, which would have come over break. Still seeing a lot of that 19 to 20 age group, or 19 to 29 age group. That remains the highest group, and that's been pretty consistent for the past 4 to 5 months. Next slide. Capacity as far as hospital capacity, still stable. We're starting to see the numbers start to decrease in those areas. Again, this is just looking at the state hospitalization trend. We're not looking at what's going on nationally. It's different by region, by state, obviously. But in Michigan, we're in pretty good shape right now. Next slide. As a nation, we are still seeing a big increase. We know that there's different strands. We've all watched the news and know what's going on in the United Kingdom. Those strands have been identified as some parts of the United States. Again, overall, the United States is going up again. However, in the state of Michigan, we're quite a bit lower than we were, especially after that huge spike right before Thanksgiving and after Thanksgiving time. Next slide. Looking at our case rate, you can see the case rate is dropped back down into the orange area. We've been about 15 days there with a 3-day lag. For percent positive, we dropped back down in the orange as well. And it looks like we've been there about the same amount of time. Next slide. Again, looking at the Oakland County average, looking at a different data table, which is sometimes easier for people to see. You can see we had that huge spike in November. It's been trending down. You can also see the cases per day at the top right. Looking at yesterday at 196. One thing you're going to start to see on the Oakland County Health Division website is they're starting to account for the lag as well. So although you see 196 for yesterday, if you check each day, there's a good chance that it is going to go up so they can capture the tests that come in later. Next slide. We were one of the first districts in the United States to sign up to be part of the Brown University and School Superintendents and Principals Association dashboard. And the goal is to report our data so we have an idea whether or not transmission is taking place in school. We do know that transmission does take place in schools. We know that for a fact. What the data currently suggests, though, is that it's at a much lower rate than what you see as far as community spread. So you look at the students enrolled, over 36, enrollments over 36 million, that is divided by staff, students in person, students online. So that's something we'll keep sending our data to and keep track of as well. And I believe this was mentioned in one of the CNN reports over winter break, where they talked about schools and transmission and what is taking place on a national level. Next slide.
Thanks, Pat.